Arise has been up and running for 2 years now. The beauty about this initiative is that through the flexibility of the funding that we received from CDC, we were able to actually have communities tell us what their help needs. So we're not prescribing for them what they need to do with the funds, but they're actually thinking through what are the root causes in their communities that are causing these systemic inequities and how we can use these fundings to address them. We have 11 coalitions, but for each of these coalitions, using the same funding stream but doing totally different work in their communities, whether it be addressing food insecurity, addressing transportation issues, looking at the value of community health workers, just a gamut of things that regular funding would not necessarily address.
A lot of people are between meals or they can't afford meals. And one of the things we found out through our well-being survey is that a lot of our chronic health conditions are related to not being available to nutritious foods. We thought by providing another venue or another vehicle via our food pantries to have a micro-pantry, these things, it makes it fully accessible for people to get groceries when needed, so no family would go hungry.
The greatest need that we found in our county was access to health care, and a large part of that was the need for providers, but also the need for transportation. People didn't have a way to get to their physical or mental health appointments. We worked with a transportation company. It didn't work as well as we wanted, so we kind of had one of those fail forward moments. Working specifically through Arise, we had the ability to pivot. So then once we were able to come back to the table and say, this isn't working, let's pivot another direction, everything just started to blossom after that.
The area where we are, they don't have any grocery store. People can't even afford to buy any food or find the food. So we have this big garden, outdoor garden. We have these raised beds. And last year we produced over 1.4 tons of food, which we were able to distribute to the community.
We brought 100 plus community leaders together to have a large conversation for one entire day. And in Quincy, what I want folks to understand is that we don't talk about race, racism, equity very often, but through the Quincy Arise Coalition, we were able to bring some organizations together to have a little bit more power, a little bit more pull, and drawing other organizations to us to begin to have those conversations.
Before this, no one had any type of programs regarding health equity. It wasn't in the language that people use today. We have more involvement now, people who literally didn't speak up at all in the community coming out and sharing that they want to help and they want to be a part of the change. So I think Arise definitely helped increase participation when it comes to this health equity journey.
Having this model in the community and say, hey, we're all coalition people, you can be partners, so it's something that I think was missing a long time. So it has helped us to set goals, and we're still in the middle of the journey. We are not there yet, but I think we're on the right track.
Just gave me definitely a different way of looking at things, and it gave me more resources. I mean, in general, I feel like I can email so many different people and say, how did you make this program work? Because I think it might work a little bit in our community, not exactly like that, but where did you start?
This Arise journey has been one of the highlights of my professional and personal career. It has illuminated other folks around the country who are doing this work that we are now connected to forever. If we ever need anything, if there's ever room for collaboration, there are folks all around the country and all around the world that have been participating in Arise and Rise initiatives and We in the World initiatives, and that means that we're never alone. That means if we need help, if we need to call on someone, if we are starting to feel helpless, we can call someone and feel hope and get some hope. And that's something that is invaluable. You know, you can't buy that, you can't get that anywhere else but going through an experience like this.
I've lived in this county my entire life, and I'm a fourth generation in the county, and I didn't realize, even as a social worker, the actual need that was out there until we started collecting all of the data. I got to learn that we are a far more economically disparaged area than I thought we were. But I also got to learn even more about my community, that whenever there's a need, everybody really does come together to do their best to fill it. And I'm thankful that I get to live in a community where people care so much.